Treatment options tailored to your goals and expectations. That's the message behind Solaire Cosmetic and Plastic Surgery. Their goal is your total satisfaction with not only your surgical outcome, but your overall experience. And with more, I am happy to welcome back to our show, Dr. Pedro Solaire. And today he brought in Diana Nelson. Welcome. It is good to see you guys. Good to see you again.
Likewise. Thank you for having us.
You want to talk about something very specific that you've seen in your practice, and something that's a little disturbing, perhaps.
So I still do a lot of breast augmentations, but through the years, I've seen a lot of patients, and I shouldn't say a lot, I've seen patients come back, mine and others, who have had breast augmentation and have very non-specific symptoms. The more common ones tend to be fatigue, brain fog, joint and muscle pains. And oddly enough, these women, a significant amount of women get better after removing the implants. For some time, especially when I was in training, we were sort of taught, if you will, and the evidence was not there that there was anything linked between the implants and these symptoms. However, seeing patient after patient coming in, and especially after my last patient, who is here with me today, and I want her to tell her story, I'm convinced that there is a link. What it is, we haven't found it yet. Mm-hmm. And I think that's part of the process as to why we're here today.
Well, of course, there is a new initiative, BII it's called. And Diana, I'm so thankful you're open to your story. Talk about how you did have breast augmentation and you knew things weren't right.
At 50 years old, I was diagnosed after a routine mammogram with breast cancer. So I opted to follow every protocol. I'd been medical for a long time in the field. So I had a total mastectomy with implants, and I love them. I looked like I was 16 again. I'm gorgeous. I love them. And I could look in the mirror and put cancer behind me. Yeah. I could say I never even had it. Yeah. There was for 15 years. It was incredible. But the anxiety started probably maybe like a year in, and I just assumed I had, had some problems with, just regular life was just life.
Yes.
And then I assumed the pain was just old age.
Oh, yeah.
Right, because I'm 65 this month, and I just figured old age. And then I came to Dr. Solaire because I wanted to replace them. It was time. They're not a lifetime device. It's every 10 years. And when I left his office, I started to do research, and I stumbled into breast implant illness and realized I had every symptom.
Wow.
And I had gone to medical doctor after medical doctor. I went to the psychiatrist. I took gabapentin. They routinely drug tested me because they thought I was drug seeking from the pain.
Oh my goodness.
I got small little diagnoses like maybe fibromyalgia or one of those kinds of things, but they never really said what it was. Pretty much they would indicate by their attitude it was in my head.
Oh my goodness.
And my counselors thought it was in my head and kept giving me more meds. So until I looked into it, and it was unbelievable. In my room that night, as I'm watching story after story, realizing like, this is not in my head. It was such a relief.
No kidding.
So now my goal literally is to educate.
Well, and you know what? We've only got a little bit of time left. What's the solution? You found a way to still be able to help people like Diana.
Well, I think that's what we're looking into. Mm-hmm. There's a lot of talk out there. There's a lot of physicians that talk about en-bloc resection, which means taking out the implant and the capsule all together at once. Mm-hmm. But really, we don't know the answer. We don't know if just simple removal of implants, removal of the capsule, total capsulectomy, and I don't want to get into all the different, right? But none of the current studies have shown improvements. But what I do know is that a significant amount of women get better, if not total improvement, a significant amount of improvement, or at least 45 to 50% better. And many are happy with the way that they look even after explantation. If not, they have other options, as you were saying, such as a breast lift and even fat grafting that can be done to replace the volume of the implant.
Oh, and I'm so glad to hear Diana got her life back after BII, thanks to Dr. Solaire. If you want to contact him and his team, there's the information on your screen.